is Dr. Eisenbrown. I'm here to answer some of your questions about the common urology problems that we see. All right, let's talk about something else that I see very commonly, which is pain with intercourse. A lot of women have pain with intercourse and don't seem to be able to get an answer for it. The most common cause of pain with intercourse is something called hormonally mediated vestibular denia. And yes, I had to practice a lot to be able to say that, so I don't use that very often, but let me explain to you what that is. I need to explain the anatomy to you so that you fully understand. The female genitalia actually has 3 embryologic layers of origin. The outside part of our genitalia is called the vulva, so that includes the mons pubis and labia majora, and that comes from a layer of germ tissue called ectoderm. Ectoderm is where all of our skin comes from, so it has very similar characteristics. It has hair, it's dry, it has sweat glands, so that makes sense. It is also not a hormonally dependent tissue. When you separate the labia majora and the labia minora, you will notice that on the labia minora there's a very distinct change in the color of the tissue. It goes from a flesh color to more of a peachy or even a pink or even a red color. This is called Hart's line, and this is where the vulva meets the vestibule. The vestibule goes from Hart's line to about 1 centimeter inside the remnant of the hymen. The vestibule comes from the urogenital sinus, which is the urethra and the bladder and your urinary system comes from. The rest of the way in is the vagina, and the vagina comes from mesoderm. So you have 3 separate layers of tissue. You have ectoderm, urogenital sinus, and then mesoderm. And the reason this is important is because they develop differently and they have different blood supplies. They also have different needs. For example, the outside part, which is the vulva, doesn't need any hormones. The vestibule needs estrogen and testosterone, and the vagina needs estrogen. Now, most people are unaware of the fact that the vestibule has some need for testosterone. But if you look at the embryologic development of the male and the female genitalia, the vestibule is analogous to the prostatic urethra. And we women have several glands in the vestibule that are very similar to the glands in the male genitalia. They are our vestibular glands. They are located in the leaflet between the labia minora and the remnant of the hymen. They're at 1, 3, 5, 6, 7, 9, and 11 o'clock. These glands are testosterone-dependent glands. As we lose our estrogen, we also lose our testosterone. When we lose our testosterone, these glands become unhealthy, and any unhealthy gland cannot clear itself of secretions and bacteria and therefore become very tender. This is where the pain with intercourse occurs with hormonally mediated vestibular denia. These glands that are right there by the remnant of the hymen become very tender, and then when you have intercourse, you will have pain. It also causes pain with speculum exams or even a tampon, anything that's placed in the vagina. So if you have pain with entry of intercourse, it is very likely that you have very tender vestibular glands. The good news is it's a very easy to treat problem. All we have to do is give those glands some testosterone. You can do that topically with an estrogen testosterone topical cream that I can have compounded for you, or we can replace it systemically if you're also interested in improving your libido, which many women are. Thank you for your attention, and I really hope that this has been helpful. If you have further questions, please don't hesitate to ask me when we see you in the office.